make some emergency information I want to share with all of you. इस हॉल में आपके जस्ट पीछे you can see there are 3 exits और ईश्वर हम सबको एक अच्छी सोच के साथ हम आए हैं तो सब कुछ बहुत अच्छा होगा। लेकिन जस्ट फॉर योर इन्फॉर्मेशन, इन केस ऑफ एनी इमरजेंसी आप पीछे के 3 गेट्स जो हैं एग्जिट गेट के तौर पर उसका इस्तेमाल कर सकते हैं और उन गेट से निकलने के बाद राइट साइड में आप टर्न लेंगे, आगे जाकर लेफ्ट साइड में एक असेंबलिंग पॉइंट है। तो इन केस ऑफ एनी इमरजेंसी ये हमारा इमरजेंसी एग्जिट रूट होगा। इसके लिए सिर्फ आपको इन्फॉर्मेशन के लिए हम बताना चाहते हैं। सो अगेन रिक्वेस्टिंग ऑल ऑफ यू प्लीज़ टेक योर सीट्स। आप सभी बैठ जाएं, मोबाइल फ़ोन साइलेंट मोड पर कर लें, कोई मूवमेंट ना हो। हमारी प्रोसीडिंग्स शुरू होने जा रही हैं। देवी सज्जनों नमस्कार। क्वालिटी काउंसिल ऑफ इंडिया और नेशनल एक्रेडिटेशन बोर्ड फॉर हॉस्पिटल्स एंड हेल्थ केयर प्रोवाइडर्स दैट इज़ NABH, उसकी तरफ से इस NABH पेशेंट सेफ्टी कॉन्फ्रेंस 2024 में आप सभी का जो हेल्थ केयर से जुड़े हुए देश के अलग अलग हिस्सों से बहुत बड़े डिग्निटरीज और एक्सपीरियंस्ड पर्सनालिटीज़ हैं, आप सभी यहाँ आए हैं। आप सबका बहुत बहुत स्वागत, अभिनंदन। हेल्थ एक हमारी सोसाइटी की, इस देश की एक बेसिक नीड है और दरअसल जब हम विकसित भारत की बात करते हैं तो उसकी नींव जो है वो स्वस्थ नागरिकों पर ही आधारित होती है। हमारे सिटीजन्स हेल्दी होंगे, स्वस्थ होंगे, उनको बेहतर हॉस्पिटल की या ट्रीटमेंट की पेशेंट सेफ्टी के नज़रिए से उनको बेहतर सुविधाएं मिलेंगी। तो विकसित भारत का जो संकल्प है वो फिजिकल जो हमें दिखता है कि इंफ्रास्ट्रक्चर डेवलपमेंट्स, रोड्स और तमाम तरह की चीज़ें, उसमें ह्यूमन बींग्स, उसका जो ह्यूमन एस्पेक्ट है वो बहुत ज़रूरी है और उसको बेहतर बनाना, हेल्दी बनाना एक बहुत बड़ा संकल्प है इस देश का। प्रधानमंत्री महोदय खुद इस पूरे देश में फिटनेस के माध्यम से और उनके तमाम एफर्ट्स के माध्यम से लोगों को स्वास्थ्य की तरफ जागरूक करने की उन्होंने कोशिश की है। और क्वालिटी काउंसिल ऑफ इंडिया के अंडर जो NABH है उसने इतना महत्वपूर्ण एक आयोजन आज के दिन किया है। दरअसल एक इत्तेफाक की बात है, दिस इज जस्ट कोइंसिडेंस। आज से देश में स्वच्छता पखवाड़ा भी शुरू हो रहा है और आज से शुरू होकर वो 2 अक्टूबर तक चलेगा। और ये संयोग है कि आज इस देश के यशस्वी प्रधानमंत्री श्री नरेंद्र मोदी जी का जन्मदिन भी है। तो आज से ये पखवाड़ा शुरू हो रहा है और 2 हफ्ते में स्वच्छता को लेकर फिर से हर साल इसको हम बार बार करते हैं, इसीलिए कि लोग स्वस्थ हों। स्वच्छता एक बहुत बेसिक चीज़ है, बेसिक नीड है जिसको लेकर अवेयर होना ज़रूरी है। तो इस तरह के हर लेवल पे जो प्रयास होते हैं उसमें आगे चलकर आप सबकी सहभागिता बहुत महत्वपूर्ण हो जाती है और इसीलिए हेल्थ केयर में और पेशेंट सेफ्टी के क्षेत्र में बहुत ज़रूरियात जो हैं सोसाइटी में उसको फुलफिल करने के लिए, उसको पूरा करने के लिए इस तरह के कॉन्फ्रेंस के माध्यम से हम आगे बढ़ रहे हैं। देश के 140 करोड़ लोगों के बेहतर स्वास्थ्य की सुविधाएं उनको उपलब्ध हो सकें, इस सोच के साथ हम आगे बढ़ रहे हैं। सो इन द वेरी बिगिनिंग ऑफ दिस NABH पेशेंट सेफ्टी कॉन्फ्रेंस आई वुड लाइक टू इन्वाइट the CEO of NABH, Dr. Atul Mohan Kochhar, for setting the context of this conference. So let's please welcome Dr. Kochhar, the CEO NABH. In the meantime, I would like to inform you that Dr. Atul Mohan Kochhar is a renowned dermatologist, earlier as a professor and consultant with the Lok Nayak Hospital and Maulana Azad College in Delhi. He joined NABH in 16 and since December 19, he took over as the CEO of NABH and he is here just for setting the context of today's conference. Dr. Kochhar, please.
Thank you so much. Good morning, patient safety champions. Good morning, all. So today, 17 September, we all realize is the World Patient Safety Day. Since 2019, WHO stressed that we must commemorate this day to reaffirm our faith in the cause of patient safety. Why do we need to do that? Because unfortunately, despite all advancements in modern medicine, despite all upgrades of technology, unintended patient harm, unintended errors of medication lose lives. Hospitals are not very safe places despite all care. To discuss and deliberate on all the issues, such days are extremely important for all of us. It is indeed a proud privilege for me on behalf of NABH to welcome all of you. It's a very prestigious feeling for us that some of the leading luminaries of the healthcare ecosystem are today here with us. They've agreed to spare their invaluable time. We also have amongst us quality professionals, hospital managers, hospital leaders, and what may. And I'm immensely grateful to all of you, patient safety champions, for coming here on a working day, sparing your time, sparing your thoughts, sparing your guidance for all of us. NABH and NBQP have lined up a scintillating academic feast. Please, there is something for all of us. Do be a part of that. Do share your wisdom. Do share your guidance on that. And we have a whole lot of series of new initiatives, NABH 3.0 transformation, which we would see later part of the day. Over to you, Janendra ji, and over to you, all our panelists, for guiding us once again on extremely relevant, very thoughtful discussions across the board on healthcare. Thank you so much.
थैंक यू डॉक्टर अतुल मोहन गोचर। दिव्य सज्जनों, हेल्थ सेक्टर में और पेशेंट सेफ्टी में, चाहे वो WHO की गाइडलाइंस हों, सस्टेनेबल डेवलपमेंट गोल्स जो इंटरनेशनल लेवल पर और नेशनल लेवल पर भी जो सेट किए गए हैं, या नेशनल हेल्थ पॉलिसी को देखते हुए बहुत सारी ऐसी गाइडलाइंस हैं, इश्यूज़ हैं, रूल्स हैं, रेगुलेशंस हैं, और उसके हिसाब से एक बेंचमार्क, एक क्वालिटी एश्योरेंस का विश्वास जो है वो पेशेंट्स को एक ट्रस्ट का भाव उसके अंदर हो। इस बात के लिए बहुत सारी एस्पेक्ट्स हैं जिस पर अलग अलग सेशंस में हम चर्चा करेंगे। एंड लेट्स स्टार्ट विद आवर फर्स्ट सेशन, पेशेंट्स फॉर पेशेंट सेफ्टी। और इस सेशन को मॉडरेट करने के लिए मैं सभी मॉडरेटर और पैनलिस्ट को बारी बारी से इनवाइट कर लेता हूँ। द मॉडरेटर ऑफ दिस सेशन विल बी डॉक्टर लालू जोसेफ। आई विल इन्वाइट हर ऑन स्टेज। डॉक्टर लालू जोसेफ इज द क्वालिटी मैनेजर एंड एसोसिएट GS at Christian Medical College, Vellore. We welcome. तालियों की आवाज़ तो बहुत सारी आनी चाहिए आप सबकी तरफ से। This is the first session. Let's feel the energy and transmit it to others also. So, with the background in mechanical engineering and business, she transitioned from software and academia to lead healthcare quality, serving as an ISQ expert and principal NABH assessor. Thank you, Dr. Lallu. And Professor Bejon Kumar Misra, a very renowned personality of the field. He is a leading consumer policy expert with over 40 years of experience in consumer protections, ladies and gentlemen. An advocate for quality and safety, he has been a key contributor to the Quality Council of India since 1996 and has led international delegations and negotiations. Thank you very much, Dr. Bejon, Professor Bejon Kumar Misra, for coming and joining us. Dr. Aarti Verma is one of the panelists in this session, and she brings over 30 years of clinical and administrative experience, including roles with the Indian Army, private healthcare in India, and the NHS in the UK. At Max Healthcare, she oversees quality and patient safety across 14 hospitals in India. Dr. Verma is also a co-chair of the technical committee at NABH in India. Thank you very much for joining us, Dr. Aarti Verma. Mr. Prashant Tandon, I will request him to please come on stage and take his seat. Dr. Prashant Tandon is the co-founder and CEO of 1MG Technologies Private Limited, with the notable entrepreneurial background that includes founding HealthCart and working as a senior associate at McKinsey and Company. Mr. Tandon's vision for 1MG emphasizes the role of digitization in enhancing healthcare quality, accessibility, and affordability, underscoring the company's commitment to improving patient safety through the digital solutions. Thank you very much for joining us. The next is Colonel Dr. SKM Rao. I will request Dr. Colonel, please come on stage. He is Chief Operating Officer of Sahyadri Group of Hospitals and has over 25 years of leadership experience in healthcare. A decorated Army Medical Corps veteran, he is known for developing centers of excellence and leading successful transplant programs. His commitment to patient safety and quality healthcare continues to influence the future of Indian healthcare sector. Thank you very much, Colonel Saab. Then we have in this panel Mr. Rajiv Vasudevan. Mr. Rajiv Vasudevan is the founder and managing director of Apollo Ayurveda Hospitals, renowned for pioneering high-quality Ayurveda care, ladies and gentlemen. Under his leadership, the organization became the first Ayurveda sector recipient of the QCI DL Shah National Quality Award and the first NABH accredited Ayurveda hospital in India. Mr. Vasudevan was also the first Ayurveda sector assessor for NABH and contributed to to developing NABH accreditation standards for Ayurveda. We welcome here Mr. Raji Vasudevan, and I would like to invite Ms. Ramani Sundaram. She is clinical neuroscientist and executive director at Dementia India Alliance and is a leader in dementia and elder care management with over 14 years of experience. Ms. Ramani. She has driven transformative initiatives in neuropsychiatric assessments and care planning, and her expertise in grant management and patient-centric projects has significantly advanced dementia care. A recognized global speaker, Ms. Sundaram continues to advocate the active aging and high-quality healthcare. We welcome Ms. Ramani Sundaram also in this panel. And formally, with the plant, I would like to invite Dr. Atul Kocher to welcome all the panelists, and also I would like to invite here on stage our Shri Rizwan Koita ji, Chairperson NABH, is also here on stage. So please put your hands together to welcome all the dignitaries one by one. The guests sitting here, they will be deliberating on this very important topic which has been assigned and which has been decided for this first session, patients for the patient safety, complementing treatment for better outcomes. एक trust पेशेंट के मन में हो हेल्थ केयर सिस्टम के प्रति, हॉस्पिटल्स के प्रति, सिस्टम के प्रति, जो हेल्थ केयर सिस्टम है उसको लेकर वो ट्रस्ट किस तरह से हो और किस तरह से हम क्वालिटीज़ को बेटर कर सकते हैं, इन इश्यूज़ को, इन मुद्दों को लेकर ये सभी बहुत एक्सपीरियंस्ड डिग्निटरीज़ यहाँ पर हैं. उनके साथ ये डेलिब्रेशंस होंगी. जिस सेशन को मॉडरेट करेंगे डॉक्टर लालू जोसेफ, क्वालिटी मैनेजर एंड एसोसिएट जनरल सुपरिंटेंडेंट CMCH. सो वी विल हैव अ ग्रुप. सर प्लीज़, रिजवान साहब, please, we will have a group photograph first, and I will request all the panelists to come together for this group photograph. ये memories हैं जो future के लिए हैं, और आपके deliberations हमारे इस देश के future के लिए हैं, हमारे देश के नागरिकों के 140 करोड़ लोगों के future के लिए एक better future हो और quality health sector में उनको quality services मिले, उसके लिए है. तो एक बार आप सबकी तालियों की आवाज़ यहाँ तक आनी चाहिए. उन सबका हम वेलकम करते हैं, सबका बहुत बहुत अभिनंदन करते हैं इस बात के लिए कि सभी आज के इस कार्यक्रम में आए. प्लीज टेक योर सीट्स एंड आई विल हैंड इट ओवर टू डॉक्टर लालू जोसेफ टू मॉडरेट द सेशन.
Very good morning. And this is the first session. And congratulations to NABH for giving the importance to patients. The first session is for patients, patients first. Let's give them a big round of applause, because in any conference, you will see the patient at the end. We discuss everything about administration, we discuss about quality, we discuss about patient safety, and we don't discuss about patients. Now, this session is all about patients, patients for patient safety, complementing treatment for better outcomes. Lot of work to be done in this area, and I think WHO is insisting on us to co-produce, co-create, and coexist. So it's important for us to understand this concept, and not just the clinicians, but everybody in this healthcare ecosystem. So we have a very good array of panelists here today. I don't know from where Dr. Atul brought all of us together. You know, different arena, different spheres. So it's going to be very interesting learning from each one of them as to what is important for the patients, how do we work together, how do we make this ecosystem and co-create along with our patients. Dr. Atul mentioned about the trust deficit. I think that's the most important thing to focus on. So how do we work around this trust deficit? How do we make patients as equal partners and work with them? When we are admitted in the hospitals, my husband is admitted now in the hospital. So he is jobless. From morning to evening, it is just waiting for the food to come. Not a big problem, he had a mild fracture. So, you know, throughout he's sitting and finding fault with what is happening. It is his own nurses, his own hospital. So imagine the plight of a patient Now, if you are able to engage with the patients when they are admitted, when they are in the OPD, when you talk to them, understand from them what to be done, then they are not going to be complaining. They are going to become equal partners. So I had an organization called CAHO, the Consortium of Accredited Healthcare Organizations in India, and we partner with NABH in a lot of aspects. We are there to promote quality. So we decided to get into this exercise of validating PREMs, patient-reported experience measures. So what do these PREMs do? Trying to understand whether our safety protocols in our hospitals are implemented appropriately. Talking to the patients, understanding from them if the surgical site marking was done by the doctor, was it done in the ward or at the holding bay, where exactly are these protocols happening? That way we are able to understand if our protocols are implemented. There are other ways of engaging with the patients like the patient advisory councils, patient-reported outcome measures. There are far too many. Now, in our country, are we ready? NABH has done wonders. I think all of us have been brought together by NABH. Prior to NABH, I don't think all of us knew each other. Today, it's a wonderful ecosystem, people coming together, singing the same song. It is all about quality and patient safety. Let's once again give NABH a big round of applause for what they have done, creating this quality movement in this country. And I'm very glad that they are going to be championing the cause of bringing patients together so that this trust deficit can be sorted out. So we have a lot of work to do, lot of panelists here to listen to them, and time is a constraint. So I'm going to ask each of the panelists to limit themselves to about 4 minutes. I think time is very, very critical, crucial. Lot of panelists here, lot of sessions here, and we have to sit and listen to everything. So please limit yourselves to 4 minutes. So I'll start with the senior most here, Professor Bejon Misra. He is a veteran in the field of patient engagement. He champions the cause of patients. So the first person who's going to talk today is going to be a champion in the cause of patients. And he's a very, very strong advocate of patient safety. I'm going to request him to enlighten the audience on how patients perceive quality safety. We talk about safety. What do patients think of safety? Their expectations from the hospitals to assure safety. 2 questions, sir.
Thank you. Thank you very much. I'll stand up and speak because I learned that from Mr. Chakravarti. See, when you stand up and speak, you speak better, you have better eye contact, and you're able to express yourself from the bottom of your heart. So, good morning, friends.
Good morning.
Little louder. Good morning.
Good morning.
Wonderful, wonderful. So, as patients, what do you expect? As patients, what you expect is quality and safety. And today we are going to talk about, because that's the slogan for this year on the World Patient Safety Day, is improving diagnosis for patient safety. And the tagline is, get it right and get it safe. Which means what? When I look at NABH, when I enter an hospital, I'm assured of quality and safety. As a patient, I look at NABH and I feel very safe and I feel very protected. Why? Because I trust in that brand. I trust in that logo. I trust in the mechanism. When do we miss out in terms of the mistrust or the trust deficit, as the chair explained? We miss out when we don't have mechanisms in place where I, as a common patient, would come to know that yes, this institution does not only have a logo of NABH, but it also follows and strictly follows all the compliances in terms of patient safety. And the only way you can do that is to have transparency and have communication in the language the patient expects it, not in the language which you want to give with a lot of technical jargons. They want simple communication from you that is that instrument which is diagnosing me, is it calibrated? Is it giving the right outcomes? Is it giving the right kind of measurements? And what we find is there are plethora of organizations which are harassing the hospitals But there is no one institution which gives that assurance to the patient. And we want to see NABH doing that. What we want is there should be a good surveillance mechanism in place. There should be good communication with the patients in a language with the patients expect it. And we want to make sure that if something goes wrong, it is continuously improving. Never look at a patient's feedback as a criticism. Patient's feedback is very, very rich resource for improving quality. And this is where we as patients are always looking at that the care providers, the hospitals, the service providers may not only take care of the patients in the manner they desire, but in the manner what is prescribed. And this is where I want to stress on the factor, and this is where we are starting off today, that whatever you do, it has to be in a tangible manner, made sure to the patients in the language they understand, that it is measurable. There is a mechanism which is transparent, which you can access at any time, anywhere, through use of technology today, which is enabling factor for all patients to get on their handphone. So what I want to conclude by saying is, safety comes when you build that trust, and the trust comes when you build mechanisms which assures and makes sure that they don't go wrong, and even if they go wrong, they learn to improve it, and continuously improve in the sense that when I go back there again, I find that improvement has taken place. So friends, look for it, look for NABH, look for that assurance, make sure that we assure what we can provide and we promise what we can do. So make it right and make it safe. Thank you very much.
Thank you. Thank you so much, sir. I think that's the most important thing. Look for NABH, communication, transparency, and communicating in the language that the patient understands. I think that certainly builds up the, the trust factor. So that was wonderful. And now let's listen to Dr. Aarti Verma. I don't think she really needs any introduction. She's been championing the cause of accreditation, chair of the accreditation committee. Madam, what do you think that you have done in Max Healthcare, such a large chain of hospitals, and you take care of quality in about 14 hospitals? What have you done in Max Healthcare towards patient engagement?
Thank you, Lallu. Yeah, so we all know that patients and their families come in with a myriad of feelings and emotions when they are with us. They are apprehensive, anxious, agitated, sad at times, grieving at times, illiterate about what's going on with their health, their illnesses, sometimes over-knowledgeable with Google and information and second opinions of their relatives who are doctors or in the healthcare field, critical, grateful, thankful. So we perceive all sorts of emotions within our patients and our families and their families when they are with us. Our group of hospitals in particular are treating mainly very critical illnesses, tertiary, quaternary, liver transplants, kidney failures, ICU care. More than 50% of our beds are critical illness cases. So we face another different challenge of how to handle our patients with compassion while we're taking care of their critical needs. So some of the tools that we have used which have really worked, and I hope to share very quickly in simple tools that most hospitals can adopt, which will help them. Of course, at the service end, there's fantastic technology available. So there are health apps which get all the patient information at one spot, which is also available to the doctors. They can book their appointments, they can cancel, they can have virtual consults. So the service aspect is very well managed, I think, in all hospitals. What we did for our OPD patients is that we have set up post-OPD desks at every OPD area. So after a patient has seen a doctor, sometimes they are confused. What next? Where to go for a test? How to take a next appointment? Where do I have to go for a second referral? So putting up a simple post-OPD consultation desk for a patient, which facilitates their next move after they've come out from the OPD, has really helped patients understand and navigate the system. A simple tool, small resources, but it has worked phenomenally. We have done extensive training for all our doctors on communication skills, 6 modules. Really huge amount of impact it has had. We made the doctors the trainers. So oncologists would train the doctors on how to break bad news, how to do grievance, how to do bereavement handling. Huge impact in terms of showing compassion and helping patients through the difficult illnesses that their relatives are they or their relatives are around. Informed consent, very, very important in every, I'm not going to take too much. Nurse rounds every 2 hours to every room, not in the ICU, to every room, so that they're continuously talking to the patients and asking them, do they need help, any coordination, any facilitation. So every, whether it's daytime or nighttime, a gentle knock and saying, are you all right? So every 2 hours we have a nurse round in every room. Then we've set up a multidisciplinary team meeting system, which has worked phenomenally, has had a very good uptake with our clinicians. So every time a patient is in an ICU or in a critical state and has stayed for more than 5 days or had 3 or more doctors visiting them from different specialties, our electronic health record system alerts, sets out a trigger to the doctor that a MDT, we call it a multidisciplinary team trigger, is available. Do you want to set up a multidisciplinary team review of the patient and a family briefing with the family? So if the doctor says yes, then they set up a meeting where all the doctors who are involved with the case will do a virtual call or physically meet and then brief the family together. And believe me, this has been one of our best success stories in handling patients' apprehensions, their questions, their understanding the complexities. Ek doctor abhi aaya, kuch bol ke gaya, dusra abhi aaya. This has streamlined the communication and the engagement process with the patients phenomenally. It's been a great success story in our organization. We have also set up a crisis management team concept where anytime there is a serious adverse event, say for instance a death in the OT or a death during transportation in the ambulance or a maternal death, which are rare events, but they do happen, or a patient fall. So in addition to the primary frontline team who's handling the situation, we set up that within 5 minutes, a CMT code is announced where the front office, the medical superintendent, the security person comes to that spot and facilitates everything that is needed to help the team manage the patient and the requirements. So this has also worked very well to also handle their complaints and take care. So any llama case, any serious adverse event happening, any sentinel event happening, we have a support team which comes in within 5 minutes to handle everything with compassion and make the further experience of the patient and their family seamless. So these are few of the things which have worked wonders in our organization. With that, I'll stop here. Thank you.
Thank you. Thank you so much, ma'am. I think it's a lot of learning and good to hear from leading hospitals as to what you do. I particularly like the multidisciplinary meetings, and I'm sure patients must be liking that too. So let's listen to Mr. Prashant Tandon. I think you listen to the patients and you have taken your services to the doorsteps of the patients. How do you ensure patient safety? I often wonder, you must be delivering drugs at the doorsteps. How do you ensure safety of your service? And what are the major steps you have taken to prevent wrong dose, wrong drugs being delivered, educating patients about the drugs? If you can explain to us, please.
Thank you. Thanks for inviting me here. It's an honor and privilege to speak on this important topic here. And I think as I see it at 1mg, patient safety or patients per se are not just a stakeholder. I think they are the reason for our existence. So everyone else is a stakeholder, whether it is the healthcare provider, doctors, clinicians, pharmacists, phlebotomists, the entire ecosystem they are stakeholders in the primary customer, which is the patient, and getting that patient high quality, reliable access to whatever they need, dealing with a condition, a disease, any kind of abnormality is a big challenge enough. And then if they have to navigate the ecosystem to just feel comfortable that they are getting the right thing, that is the one pain we thought we could reduce a little bit by ensuring a supply chain that is end-to-end authenticated and controlled by us. So now, how do we do that? Two things we primarily deliver to consumers. Three things, I would say. Number one is information and content. And that's how we started. Every month around somewhere between 35 to 40 million consumers come on our platform and read about various things about healthcare. All that content goes through a very sophisticated system of editorial, that is doctors and pharmacists and pathologists all working together, writing the best content or bringing the best content from all over, verifying, validating, peer reviewing before we put it out for the consumer, so that when you read about a medicine on 1mg, you get a clear view on that this is the right information, this is transparently what you need to know. Second part is medicines, and I think that's a big challenge in our ecosystem today. Multiple layers to it, but what we learned over the last 9-10 years, the supply chain is very, very fragmented, and unfortunately, we still do not have barcodes or QR codes or any authentication mechanism that the medicine I am getting is actually coming from the right source and it has been stored the right way. Two simple data points. Number one, we've got some 50,000 pharma warehouses in the country. Not more than 500 would be air conditioned or temperature controlled. Even medicines at room temperature, we know it means 25 to 30 degree storage. It's very hard to expect in our ecosystem that is happening today. So now, what did we do? We decided that, okay, we need to have a full authenticity of temperature control right from the source to the consumer. So today, we buy directly from most pharma companies or their CFAs or authorized distributors. All our warehouses are temperature controlled, and then when the medicine goes right up to the consumer, even for cold chain, the delivery boxes, we have an IoT device that gives temperature track right up to the patient, and one can go back to right at receipt. So now, control over the supply chain, authenticity of that. There's a huge industry out there where expired medicines are cleaned and restamped and put back in, fake medicines, all of that stuff that is very dangerous. We believe the best way to control it is have a direct relationship where we get the right medicine to the consumer. Similarly, on diagnostics, there are no shortcuts. We have to operate with the highest quality, and our diagnostic labs, we made sure the sister organization of NABH, NABL, every single lab we operate is NABL accredited. But that's one part of it. I think the other part of it is the people who are actually going door to door, day by day, every day, to deliver that healthcare services. How do we train? How do we make sure they are equipped to deliver a quality of care or a quality of care experience that actually stands the expectation of the consumer? And by putting the consumer at the center, small things we have done over the last many years, but today, pretty happy that our patient satisfaction ratings, which are not a metric, it is actually the core driver of our business. So now we operate at NPS scores of around 70, which in the consumer world also is considered a very high benchmark. So best organizations in the world operate typically at that. And just for context, at least in the US, healthcare companies typically operate at single digit or negative NPS, where very few people enjoy an experience of dealing with a healthcare entity, which should not be the case. So I think from our point of view, by putting the patient right at the center, making sure what they get is authentic, how they get it is well controlled and in an empathetic manner, we've been trying to make our little change in this ecosystem. So that's pretty much what we do.
Thank you so much. I think it's all about having the patient at the center. So the message is loud and clear here, have the patient at the center. Now let's listen to the chair of our technical committee. We all know Colonel Sunil Rao. He's worked meticulously for the 6th edition with a great team. And would like to ask, sir, what have you done as something new towards patient engagement in the 6th edition standards, sir? have you actually incorporated some of the components that we are talking about in the 6th edition?
Thank you. Thank you. First of all, thank you to NABH, and I'm part of the family as technical committee chair. Thank you for inviting me here to speak about our standards, which is the mother standard for all other NABH standards. And all of you are already aware that patient safety and quality has been the core of all our NABH standards from the beginning, from the first edition. Our mentor is here, Air Marshal Pawan Kapoor sir. So they have steered this cause of patient safety and quality since beginning. And year after year, edition after edition, the portion of patient safety has increased only in the standards. I have very small time to speak about patient safety vis-a-vis the NABH standards, as my mandate is, as the question has been asked about that. So first of all the elements which were there from edition to edition, which kept on increasing, patient communication, patient safety, education, patient rights, of course from the first edition onwards, patient responsibilities, educating the patient in right way, multidisciplinary meetings, multidisciplinary counseling, all this has been there since beginning. Patient rights and education has been made a separate chapter itself, and this is there with various standards and objective elements, right? The communication portion got enhanced. I would say enhanced communication was the first one which was brought in the NABH standards. So that's why enhanced word I'm using. This particular standard became, with its 6 objective elements, became the gold standard for all the patient communication areas which were developed after this particular thing. But in 6th edition, I would like to bring out that which is being again launched today during this National Patient Safety Conference. So in this, a lot of efforts have gone to bring in newer concepts, especially regarding the patient and patient safety. So patient safety hitherto was completely one-sided, I would say. One-sided in the sense that all other stakeholders except patient was being incorporated and was being talked about more and more with newer and newer objective elements. But this is the first time in 6th edition that all our team has been responsible for this, to bring in patient engagement as a tool for patient safety, to improve clinical quality, outcomes, and safety. Again, all these elements have been brought in as a separate standard and objective element. So in the this particular objective element, we have taken care of various elements like patient support groups for various diseases, for various specialty-based patient support groups. Then we have also taken care of new concept which is already there in some of the hospitals and the Western world, patient advisory councils. Patient should be considered as one of the stakeholders, and in terms of various decision making which happens in the hospital, the patients are to be involved. The way to do that at a broad level, at NABH level, to advise hospitals to incorporate patient safety councils or patient advisory councils, in which the patient will be inherent part of it. And also based on the same thing, like all of us have been nominated today by NABH as patient safety champion. Here now in 6th edition, we are saying that patient becomes our patient safety champion. So the patient has been nominated for the first time as patient safety champion. So that I think is a great achievement from NABH side. And that is the major stakeholder has been brought into the fold of NABH standards. That's how we view this particular edition, that patient has been made as a center point for every single objective element. In each and every objective element, some portion of patient involvement has been made. Thank you very much.
Thank you. Thank you so much, sir, for bringing patient to the front and for bringing in the standards for patient engagement. So let's listen to Dr. Rajiv Vasudevan. He's a very well-known advocate of Ayurveda. Sir, do you feel patients are better engaged in Ayurveda? If you say so, what can we learn from you?
Thank you very much, Dr. Lallu. In 4 minutes, let me try to encapsulate truly where Ayurveda as a paradigm can add value to the entire space of healthcare. The context we need to begin with is by telling safety lies, and the way we see it from Ayurveda is it lies in patient empowerment, going beyond engagement to very, very systematically building patient empowerment, family empowerment as a cornerstone of the care process. So as we see from I call it the insight continuum, you empower the patient with the right insights lead to right attitudes lead to the right behavior leads to right outcomes. It is not a transactional one-point intervention that we are speaking about. We are speaking about life cycle health management. How do you go beyond the transaction in the hospital and then empower the person for sustained well-being beyond the care environment? The fact that today people mostly come with multimorbidity. The US, 76% of the healthcare bill is contributed by people with 5 or more chronic diseases. So this is the fact of the matter. So when you look at multimorbidity, we also need to consider health-related quality of life. So not just disease-based parameters. And who's best placed to talk to you about healthcare QOL? It is the patient. So we have to understand that where does really patient safety comes when the patient knows what to report, when to report in the language that he can best express. The fact that body and mind is very important. The mind is probably contributing, as we know, maximum disability today is contributed by mental health, not just physical health. You know, the DALI, maximum contributed to disability adjusted life years. The fact that patients come to Ayurveda in an acute on chronic condition, right, for rehab, and with highly vulnerable status because they've already visited multiple places before they come. So in such a context, it's very important to look at empowering the patient. Average length of stay, 14 days. And then please understand, Ayurveda is whole person care. It is not a single organ, single part oriented. So empowerment becomes very important in the sense, do I capture the right information completely? So therefore, the consultation process itself is about 1 hour, 15 minutes in duration. And that model works because that's where you bring the personalization. And 1 hour, 15 minutes, the first part is personal health insight, we call it, where the patient gets to know about himself. The whole Ayurveda consultation process is not about the doctor knowing the patient as much as the patient getting to know about himself or herself, which is very, very important. The other part is that you go to establishing what we call a whole person Roga Samprapti tree or the health status tree. It is a fantastic concept. Systems thinking of the highest quality applied to establishing the pathogenesis pathways from the root cause behaviors to the symptoms that they express at a whole person level. Ayurveda affords us a framework in which, a knowledge system in which you can do this. And believe me, it's highly protocol based and highly clinical examination based, darshana, sparshana, prashna. That is the, what you visually capture, what you question and what you examine. All of this is there as you would expect in any mature system of medicine. Importantly, treatment objectives established ab initio. Am I trying to do symptom alleviation? Am I trying to do disease reversal? Roga nivritti, roga shaman. For that, there's a Chikitsa Siddhanta. Why I bring this up? It is not a one-size-fits-all. It is Chikitsa Siddhanta appropriate for that particular unique patient. Every human being is unique. And how do I bring, and that is where NABH has been central to bringing in personalization, yet in a standard process-driven approach. And I think both are eminently feasible. And when we listen to the patient's voice, I've been hearing from our illustrious co-panelists here, so much that is coming out and patient coming to the center of care. Are we able to really bring personalization with the highest level process? So I want to say the Chikitsa Paddhati or the treatment plan consists of Ahar, Vihar, Vichar, Aushad, Kriya, one or more. diet, lifestyle, counseling, medicine, and therapy, one or more, depending on the rogi roga avastha. You can't just have a one-size-fits-all. So the patient at a physical, mental level, and then and I would say even the metabolic level, we have Agni and Deha and Sattva. So it's all, I'm not bringing up something today. These are all things which was there. And the fact that with this, one very important thing, Nidana Parivarjan, which is avoidance of contributory behaviors, cornerstone of preventive health and promotive health. I don't just treat the person and go. I tell him what is it in your diet, lifestyle, mental behaviors, which is causing the disease that you are faced with today. This goes to, I'll quickly conclude. When you look at the treatment process itself, treatment objectives laid out completely, the safety guidelines, patient-specific, season-specific, medicine-specific, treatment-specific. Why do I bring this up? Before you begin this, and this goes back to the inception of our hospital chain 19 years back, patient safety, patient signs off, and the fact that patient's language is there throughout, what we call the swasthya lakshanas, that is sleep, appetite, bowel movement, micturition, state of mind, clarity of senses, and mental well-being. All of this in a patient's language we determine. And customer satisfaction, right from the beginning, we take it 3 points. 8 days after consultation, 1 day after therapy begins, 1 day before treatment concludes. And then we have a real-time CSAT determination. And I'm happy to share that we have the top 2 scores for key indicators is 98.6. 65% rate is a 5 out of 5. The balance is, the 33.6 or 32.6 is 4 out of 5. NPS score of 88%. And this is consistently over such a period because we're truly able to keep the patient at the heart of the whole thing. I want to say here that clinical outcomes, you can make it so comprehensive at a whole person level. And Ayurveda gives that paradigm. And therefore, the takeaways I would conclude is Ayurveda gives an end-to-end protocols drivable approach to patient care at the whole person level. It's personalized, whole person care allows a framework where I do etiopathogenesis reversal, which is why you get extraordinary impact, both in particularly NCDs and in rehab, and geriatric care, neurodegenerative conditions, etc. It can be, and the patient-reported outcomes, one particular thing I would like to say, last 14 years, we've been working on patient-reported outcomes, where the patient at the beginning of treatment lists down what are the problems he's faced with, and we ask the patient to give a relative weightage. This allows the doctor and the patient to align that I'm not treating for one, because we're treating mostly people with multimorbidities. So we put that down, and the patient rates on a scale of 1 to 5, poor, fair, good, excellent, very good, excellent. And from that, at the end of treatment and through the life cycle. So this gives us a very good thing of hearing the patient's feedback. And we've been doing this the last 14 years, extremely good data. And the Ayurveda paradigm allows us to integrate with modern medicine. And I want to tell NABH, if it were to go the next step, not of bringing an AYUSH together, but looking at integrative medicine in a particular way, it will be the Brahmastra for India. Healthcare, medical value travel. People come to India because rehab of the highest quality, Ayurveda and modern medicine working together, yoga coming in. This way, we'll be able to do extraordinary work. I conclude by telling safety is patient empowerment, and Ayurveda can work as a mature medical system along with modern medicine in serving patients' best interests. Thank you.
Thank you. Excellent learning. Let's give him a big round of applause. And safety is patient empowerment. Now let's listen to Madam Ramani Sundaram. She specializes in dementia care and advocacy. Again, lots to learn from them as to what we can do in our hospitals to redesign, support people with dementia, particularly when it comes to staff training in our hospitals, environmental designs, and patient care.
Thank you, Dr. Joseph. While I was listening to all the panelists, they were talking about patient engagement, they were talking about patient empowerment, giving the autonomy to the patient to decide for themselves. What if patient can't decide, can't communicate, can't engage? We represent that center of population, wherein people with dementia who actually cannot communicate their needs, then what happens? What happens when you say patient is at the center and they need to be educated, they need to be communicated? It's highly challenging. As we speak, we are talking about 7.4% of people above the age of 60 having dementia. And we know that elderly are the major sections who actually take hospital care, whether it's inpatient or outpatient. And we know that around 50% of elderly who come to hospital for any kind of ailment are likely to have some sort of cognitive impairment. And many times at the hospital level, diagnosis of this cognitive impairment is often missed. Even today in India, we say that diagnosis of dementia is as less as 10%, is what we understand. Many times elderly who are admitted in the hospital, whether it's because of falls or surgery or chronic medical management, many times the cognitive impairment that is there is often missed at hospital level because the doctors who are treating the ailment are not equipped enough to pick up the signs of dementia. So it's very important that staff at the hospital are trained to understand and pick up the signs of dementia. Hospitalization for a person with dementia is never a pleasant experience because change of environment can be extremely confusing to the person. So families become the decision maker. While all the panelists spoke about putting patient in the middle of the care, here I'm here to advocate that you need to put families at the middle of the care because they have to decide what the patient wants. And many times people with dementia, when they are admitted in the hospital, their needs are unmet because of all the referral and complicated pathways that do exist in the hospital. And for persons with dementia, it has to be simplified so that they can get the care in shorter time. Otherwise, the confusion is so more that they need to be over-medicated. So that needs to be very, very important. And hospitals play a very important role when we talk about transition of care in persons with dementia. They often require repeated hospitalization. So when we speak about dementia-friendly hospital, which is a very, very renowned concept in the West, in India, we are still taking baby steps in those areas. We feel 3 areas are extremely important when we talk about dementia-friendly hospital. A, training of staff, all the staff, including ICU, emergency, support staff, everyone needs to be trained in dementia so that elderly, when they are admitted, they are aware how to look after the person who is confused, disoriented, and completely out of behavior. We also speak about some infrastructural changes such as good signages, some dementia-friendly environment adoption that could be done at the hospital so that the environment is less threatening for the patient and it's easier for the care provider to handle the patient in the hospital. And of course, involvement of family at the center of everything because many times for persons with dementia, they often know better. A good referral pathway is also something that hospitals can think of if they do identify somebody with cognitive impairment. If there's a good referral pathway, diagnosis can be made at the hospital level. I'm going to pick up one particular point that Dr. Aarti had quoted about multidisciplinary team. That plays a very, very vital role when we talk about persons with dementia, and I think each hospital, if they have a multidisciplinary team, families will be very well supported. And also looking after the client with dementia, keeping Mental Health Care Act in mind is also something that we need to look about. And as we are speaking, we are also in the World Alzheimer's Month, where we are talking about supporting people with dementia and their family. And what best that NABH has actually given us a platform where we can talk about dementia. And also when we thought that dementia-friendly hospital is a long-standing dream in India, we were so encouraged when NABH actually took steps to add an annexure to the 6th edition of NABH guidelines on dementia-friendly hospital. And I think that's a huge, huge win for persons with dementia. We always say that it's essential to remember those who can't remember, and what best way of giving respect to that by adding dementia-friendly hospital as one of the chapters annexures to the NABH guidelines, and we thank NABH for that, and thank you for your patient listening.
Oh, that truly was a paradigm shift, I must say. Thank you so much, Ramani. So let's listen to the audience. What is the key takeaway? In one line. What is it that we are talking about? Somebody.
Yeah, there's a lady there. Yeah, get up.
Yeah.
Stand up. Swami, give her the mic, please. Anybody?
There's a standing mic there.
There's a mic there.
Yeah.
There's a mic there. Hello, madam. then we're going to go there.
Communication plays a great role, and we have to communicate, and training plays a great role in this.
Thank you. Thank you so much. So the key takeaway here is communication. Communicate, communicate, and communicate. Patient empowerment. Let's co-create, coexist. Amazing audience, amazing panelists. Thank you so much for the wonderful insights. I want to end with a very small poem. United we stand, for safety we strive. Patients and families hand in hand we thrive. Empowered to speak, educated to know, partners in care, our voices will grow. We share our stories, our experiences too, to improve care and see safety shine through. We advocate, we educate, we lead the way for a safer tomorrow starting today. So join us now in the noble quest, patients for patient safety. We are at our best. Together we'll rise for a safer day where patients and families lead the way. Thank you very much, NABH, for the wonderful opportunity, and all my dear panelists for the wonderful insights.
Thank you so much, Dr. Joseph, for moderating the session. Just 1 minute more we will need from all of you. And I will request Rizwan Sahab, our chairperson, NABH, and Dr. Atul Mohan Kochar to please come on stage. एक मेमेंटो और एक फ़ोटो फ्रेम है. दरअसल ये तमाम बातें जो हैं हम सबके जीवन को बेहतर बनाएंगी, हमारी स्मृतियों में, मेमोरीज़ में रहेंगी. लेकिन हमने इस मोमेंट के फ़ोटो भी फ्रेम करवाई हैं, अभी करवाई हैं. तो वो फ़ोटो फ्रेम भी साथ में हम आपको देना चाहते हैं आपके ऑनर में. वी आर ग्रेटफुल टू all the panelists in this session. Professor Bejon Misra, Founder Director at Patient Safety and Access Initiative of India Foundation. तालियां तो सबकी तरफ से खूब सारी आनी चाहिए, आप सबकी तरफ से. Let's feel the energy of this conference. So, thank you very much, Professor Bejon Misra. Dr. Aarti Verma, Senior VP Medical Quality Max Healthcare. बहुत thanks हम कहना चाहते हैं डॉक्टर आरती वर्मा को उनकी प्रेजेंस के लिए. And we have with us Shri Prashant Tandon, co-founder and CEO, FineMG. Colonel Retired Dr. Sunil K. Rao, Group CEO, Sahyadri Group of Hospitals Private Limited. Then Rajiv Vasudevan, Mr. Rajiv Vasudevan, Founder and CEO, Apollo Ayurveda Hospitals. Thank you very much, Rajiv ji, for joining us in this session. Thanks a lot. We are grateful to all the panelists. And Srimati Ramani Sundaram, Nightingale's Medical Trust Dementia India Alliance की तरफ से यहाँ वो मौजूद रही हैं. And of course, we are grateful to Dr. Lallu Joseph for moderating the session. She is Quality Manager and Associate General Superintendent of CMCH. Thank you very much, Dr. Joseph. Thanks a lot, and I will request all of you to please take your seats in the audience.